Join us.
Let's walk the talk.
This is 702.
But I want to start that conversation. Thank you. I want to start that conversation with Foster Mohale, who represents the National Health Department. As I said, we've been seeing what's been happening with Dudula on the ground. I'm joined now on the line by Foster Mohale, who's the National Department of Health spokesperson. Foster, thank you so much for joining me. I mean, a lot of us are watching what's happening, and it's not just in Gauteng. It's happening in Gauteng, but you then have marching KZN. So it's starting to spring off in different areas where people are complaining just about the high volumes of people being treated at public hospitals. And the answers by these kinds of organizations, these groupings, is to rid the system of the queues of undocumented migrants, illegal foreigners, so they say, in order to do this. It is something that's growing. Is the Department of Health watching it with some level of concern? Are you keeping an eye on what's going on? Because I don't think I hear enough from the department on this issue.
Yeah, good morning to you and good morning to your listeners, and thanks for this opportunity. Yes, as the Department of Health, we have consistently communicated our position on the issue of actions by Operation Dudula. We have never differed with them. We agreed with them that the issues that they are raising, they are genuine issues. But the only challenge that we have is the manner in which they express their concerns. So there's no dispute about the burden of caused by public health service caused by undocumented migrants in South Africa. So on that one we agree. But the manner in which they execute their operations, we don't agree, because as the department, we are part of government. We have to uphold the law of the country. Hence, we always say to them, as much as we agree with you, we don't condone your protest actions, because Section 27 of the Constitution of the Republic is very clear. The National Health Act is very clear. So we say until such time that there are legislative amendments, especially Section 27 of the Constitution, there's no way that as the Department of Health, we will deny anyone access to healthcare.
I understand that they had a meeting with the minister. Those issues where you disagree with them, have there been conversations about how to manage them better, how to get Dudula to adhere, at least with where the Constitution stands at the moment, and to make sure that they don't infringe on other people's rights to access healthcare?
Yeah, no, definitely. Yeah, I can confirm that we had a meeting, a very fruitful meeting with them yesterday, led by the Minister of Health and the leadership of Operation Dudula. And the good thing about that meeting is that they've got a history of engaging the Minister, Dr. Aaron Mtswaleli, even when he was still the Minister of Home Affairs, because they've been raising similar issues with him when he was the Minister of Home Affairs, and now they are raising the same issues with him in his new capacity as the Minister of Health. And the good thing that he took them through a list of policies and the pieces of legislations that as government we have to comply with. He also advised to say, guys, if you want to address this issue, there are routes that you can follow, but try to follow those routes within the confines of the law in order to avoid complicating their lives. As you remember, a few of them, they were arrested, I think, a few days ago. So that is going to work against them. And he pleaded with them, saying, guys, we agree with you, we understand your concerns, but please try to raise your issues within the confines of the law to avoid any arrest or any prosecution.
But what does the department do? Because the other thing is you're responsible for the healthcare facilities. You can make an argument that enforcement of the law isn't your responsibility, that lies with policing. But what's going wrong and the damage that comes with it will be at healthcare facilities. And that doesn't become an issue for undocumented migrants. It becomes issues for all communities in those particular areas where the healthcare facilities will be affected.
No, definitely. It's tried to give them an example to say the issue of enforcing the law lies with the law enforcement agencies, and the issue of verification of immigration status lies with the immigration unit within the Department of Home Affairs. And if, as the department, if we dare to deny anyone access to healthcare and something happens to that person will have strong grounds to litigate against the department. And the good thing is that some of the members of Operation Dudula who were part of the meeting, they are lawyers. They understand the law, as the minister was trying to explain to them, say, our hands are tied. We have to comply with the laws of the country. So, and they understood the position in which the minister was trying to unpack this issue to show that the issues of that they are raising, they are very genuine, but he pleaded with them, say, please try to raise these issues within the confines of the law and also propose long-term solutions because the protests are not long-term solutions. The long-term solution is to propose the amendments in the legislation, especially Section 27 of the Constitution, which will automatically nullify other pieces of legislation, including the National Health Act, in terms of access to healthcare by everyone. Because the Constitution says everyone. It's not saying South African, it's not saying a foreign national, it says everyone who happen to be in the country.
It almost feels like government is helpless, that begging them to understand what the laws are, that asking them, pleading with them, almost feels to me like we have a government that feels like its powers are limited, its impact is limited. It is now pleading with what was a vigilante group to adhere with the law. That, Foster, for me, doesn't bode well. But then you also have a crisis where people carry communicable diseases. If people aren't being allowed to access particular hospitals, again, it's a question of endangering everybody. Their children also have access to other kids in the communities. In fact, the very communities that Dudula claims to be protecting will also be at risk. What's the solution then there?
Yeah, no, maybe just to explain the context of pleading with them. Remember, members of Operation Dudula are human beings. They're our brothers and sisters. But we also
just
need
like
to
the
correct
undocumented
them.
migrants, yeah.
Yeah, but we also try to correct them, say the route in which you are taking, it will lead them in danger, it will lead them in jail. That is the context of pleading with them, because they are our brothers. We don't want to see them languishing in jail. Hence I said pleading them in that context, not to say we are helpless, we are hopeless as government. But of course, you raised a very important issue to say the diseases have got no discrimination, whether you are rich or poor, black or white, whether you are Foster, whether you are Tshidi Madia, so especially infectious diseases. So the only way we can control and prevent the spread of infectious disease is to ensure that we avail life-saving treatment to everyone. Because if we start discriminating, all our efforts are not going to bear the fruit. So hence we say for now we will continue to provide healthcare service to everyone who happen to be in the country in compliance with the Constitution, but also as part of our efforts to contain the spread of diseases. Imagine now if we say we don't give them ARVs, and some of these foreign brothers, our brothers-in-law, our sisters-in-law, so it means all our efforts to contain the spread of HIV will not bear the fruits.
All right, Foster, I'm going to let you go. Thank you so much. Foster Mohale is the spokesperson of the National Department of Health, speaking there about it. They're pleading with our brothers and sisters, saying that there are lawyers in the room and they recognize what the Constitution dictates and what it doesn't. So some of your messages coming through on the WhatsApp line, Matsiri, so if Section 27 was clear, it wouldn't be a subject of different interpretations. It needs to be amended. That's one of the things that I question is the fight in the wrong place with Dudula? Should the fight not be in Parliament? But it's one of those questions I keep asking myself. Operation Dudula, another message coming through from Mukhadi Pela in Boksburg says, Operation Dudula is a blessing for South Africans in the light of the irresponsible behavior of the government leaving borders porous. Operation Dudula should now move to other sections of society like education. It's time we have a referendum on Section 27 of the Constitution. Mukhadi, there's a national dialogue aimed at having you say these things so that they can be addressed as well. We're going to speak to Dudula in just a second.
Hanging out with Clement
on 702.
Let's walk the talk.